Nothing on the Bonnell Foundation's Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bonnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast, sponsored by Viatris, Genentech, and Vertex. Here's your host, Laura Bonnell.
The Children's Organ Transplant Association, have you heard of it? It's also known as COTA. I first heard about COTA when my nephews needed a bone marrow transplant. When someone needs a transplant, they are usually living in their home state and getting a transplant in another state or another city where they might have to live for months. There are additional rent costs, transportation, a spouse might need housing or transportation, or a parent staying with that child. Rick Lofgren joins us today to talk about COTA. And as you know, the Bonnell Foundation offers lung transplant grants, but even our grants don't cover all the costs of a transplant. With COTA, you raise funds through friends and family, and then those funds are the transplant patient's funds for life. To explain it all now is Rick Lofgren. Rick, thank you so much for joining us. Excited to do this podcast and to let people know more about COTA so that more people can be helped. First of all, why don't you tell us, what COTA is all about, how it works?
I appreciate it, Laura. Just to give you the quick elevator speech of what we do and how we help patients. We're a national nonprofit organization that was founded about 37 years ago to help patients across the country. It was founded because there was a little boy here in Bloomington, Indiana, where we're based, who needed a life-saving liver transplant as a result of biliary atresia. And at that time, the parents, they had insurance, which was great, but it did not cover transplant. And so all of the inpatient stays were covered, but once they got to transplant, that was not covered. So a group of volunteers here in our community decided that they would raise money to help with his family's expenses and did so and raised over $100,000 to help the family in the very beginning back in 1986. And since that time, we've helped close to 4,000 patients across the country and raise money much the same as we did at the very beginning. And that is to raise money directly in that family's community. And sometimes that community is their hometown. Sometimes for our military families, it's multiple bases across the country and sometimes across the world. But our goal is to make sure that whatever expenses a family has for their kid's transplant, those expenses are covered no matter what the expenses are. So household expenses, medications, living costs that you're going back and forth to a transplant center from home, all those expenses that just add up. There's no way around them, but insurance tends not to pick them up.
And we have so much to talk about and so many questions. But first of all, some people may think, why do I need COTA? Can't I just do a GoFundMe? Tell me, how those differ.
Oh, that's a great question. The basic difference between GoFundMe and organizations like COTA, and there are a couple of other charities that help patients that need transplants like us. What we do is we raise money, and that money is available for that patient's lifetime. And because we're a 501c3, the donations to the organization are tax deductible for the contributors. But more importantly, for the recipient families, they're not taxable income. Whereas if you work with GoFundMe, and they do good work, but GoFundMe is a for-profit entity. So as a donor, you and I would not get a tax deduction for a gift. But unfortunately, the patient that's a recipient of those funds, that is taxable income for them. And for those families that have Medicare or Medicaid, we've seen a lot of families that have been disqualified or had to start paying a premium for their Medicare or Medicaid benefits because they have an asset through a GoFundMe account. So while it can work, if you're raising a few $100s, GoFundMe is not a bad option, but very few of our transplant patients need a few $100s. They tend to need thousands and thousands of dollars. And that's where working with a nonprofit organization like COTA makes a lot more sense.
And a couple things that I like, and again, GoFundMe is a different entity. It works for what some people are doing, is the fact that you know where the money's going. You know what it's being used for. I know that it happens rarely with GoFundMe, but there are people that misappropriate or are misleading on where the funds are going. And because you're a nonprofit, you are regulated in that sense, correct?
We are. We're monitored by the IRS and are audited. What we do is we make sure that when a family has an expense, they submit those receipts to us. Or if it's something they have not yet paid, they send the bill directly to us, and then we'll pay the provider directly. Unfortunately, with GoFundMe, what happens is that money is just deposited in the account owner's account, whether that's a checking or savings account. But unfortunately, you've probably seen in the news many times, Laura, as someone that's raised money and it was a bogus claim that they needed money for a medical issue or something else. There were a couple of things in USA Today in the past couple of years in which hundreds of thousands of dollars have been raised for claims that were untrue, and some people have gone to prison as a result of that. But our hope is that because we're a nonprofit that has been audited, we're rated by Charity Navigator and GuideStar, people can trust that what we do and the money that we raise is actually going to help patients and going directly to those purposes rather than going into someone's bank account and then disappearing forever.
And one of the things that I mentioned in the introduction was the Bonnell Foundation helps people with lung transplant grants, but we can't possibly cover everything that a patient needs because we're trying to help many people with $3,000 for each lung transplant, and sometimes they need $50,000 or more, depending on the transplant. So what I've learned from you, which I'm excited about, is not only can they take $3,000 from the Bonnell Foundation or another cystic fibrosis foundation, and you help in all transplants, not just cystic fibrosis or not just bone marrow, it's all transplants. But once they're helped by us or another organization, they can still utilize COTA, correct?
That's correct, Laura. And as a donor myself, I'm excited about the fact that the Bonnell Foundation can help patients across the country, and we want to encourage that. And one of the things that we try to do is to come alongside organizations like yours where we can help expand and stretch those dollars that are raised. So as an example, the average COTA family that works with us, their volunteer teams that we train and provide resources to right now are raising in excess of $21,000. And so if we could take your $3,000 grants, $21,000 on our end, that's a $24,000, $25,000 benefit that really can help families for not just the first year once the transplant's taken place, but for many years to come. And many of our patients, their volunteer teams have raised more money. And as a result, we're paying expenses 10, 15, sometimes 20 years later, just covering all of those medical bills, those household expenses that we talked about earlier, and ensuring that that's not something that someone, when they're 6 years old and is transplanted and now they're 36, we try to make sure that those expenses are taken care of forever.
And then something wonderful that I learned, because my nephews, my brother's kids, one went through a transplant, he is cured, and the other is going through it. And this is public information. I'm not giving out any private information about my nephews. My brother and both my nephews, who are adults now, are open about this, and they've put it on social media. So there's no secrets being given away here. It has been wonderful. And the fact that it's with them for life, if there's any complications related to this transplant, is huge, because I do know people. And since I've learned from you, I'm reaching out to these people we've helped before who still have outstanding bills that may want to do this, because what we couldn't cover, because we can't cover everything, they may be able to do this, correct?
That's correct. What we've found over the years, Laura, is that it's easier to raise money before the transplant takes place, but it's not impossible to do it afterwards. And our goal is to help families at any stage of the transplant process. So what we're finding, especially for our CF patients, that many of them, many years post-transplant, are now waiting for a kidney transplant as well, perhaps a liver transplant. And we're finding a lot of those patients that maybe 10 years ago were transplanted with a double lung transplant at a hospital. They're now coming back for round 2 because the medications have damaged their kidneys and livers. And that's an opportunity for us to help them all over again. Many of those teams raise enough money that they're still just accessing those dollars, but some of them do need to raise more money because their expenses just have been so high that they've exhausted the funds that were raised. The neat thing for all of our CF patients, we do have a grant fund. And so all of our CF patients immediately qualify for that grant fund, and we can help families immediately with some expenses they've already had or get them started for the next round of transplants.
And those dollars stay with them forever.
They do. Yep. Our longest patient, and I always point to Ben because I think this is one of those stories that every parent wants to hear. Ben's now 32. He's married. His transplant was over 30 years ago. He received a liver transplant at UCLA. Ben's doing great. And while he's still paying those co-payments and deductibles, he's still accessing the funds that were raised when he was a 2-year-old and in the hospital at UCLA.
And that can help with copays?
It can. Copayments, deductibles. We have some parents and patients that have lost their jobs. And so we're picking up some COBRA costs as they go forward with a new job and pick up insurance, which sometimes takes 3 months for that to be enacted. But we have all those expenses that we could have paid in the very beginning of this process, we can pay throughout the patient's lifetime.
So if someone's interested, take us through the process as if you were talking to them. What's the start point? What do they have to do? Do you need their tax information? I mean, how does it work?
Great question, Laura. What we encourage people to do is to go to our website, and that's COTA.org.
And we'll put it in our show notes as well.
Oh, thank you. If you go to the COTA.org, you'll find Get Started is one of the main items on the toolbar at the top, and you can take a look at what we do. There's a transplant expense estimator, so you can try to discover what are those costs that I'm going to have going forward. Many of the people that I talk to, and I talk to all of our families as we start our fundraising campaigns, they're really more worried about what do I need to get my patient home from the hospital? And they don't necessarily think about what you've discussed, Laura, and that is those lifetime costs and what happens 3 years or 5 years or 15 years from now. That's where they can take a look at those numbers and look at what are the real costs that I'm going to have. So transportation, lodging. For most of our lung transplant patients, they're at the transplant site for a month or two. Then they have to live within 30 minutes of the hospital. And so that means many of them don't get to go home until multiple months after the transplant takes place. And then going back and forth for regular clinic visits as follow-up, that's not just a 1-year kind of thing. But if they get on our website, they can take a look at the information. They can request some information. They can call us at our 800 number that's listed there on the website. But it really is a good opportunity for people to take a look at what we do. And most families we've discovered look at our website on their telephones rather than on a laptop or a desktop. And we found that mobile versions of the website work very well. You can submit information, ask questions. We have a referral list of patients that we've worked with in the past where a parent or an adult patient has said, I'd love to talk to someone and share my experience and how COTA was able to help me. But once they've decided to move forward, we have a process that we do training. All of our expense payments are done electronically. So if you're at the hospital, let's say in Durham, North Carolina, but you live in Southfield, Michigan, that money goes directly into your checking account rather than going to your mailbox with a paper check so that you immediately have access to those funds. But it's a really great process. There's no cost to our families. That's one of the neatest things about COTA is we do all this free of charge. And we do provide some of those grants, especially again for our CF patients, that will be a great way to start the fundraising campaign.
And if you did already say it, I just wanted to reiterate that it doesn't matter what you have wealth-wise because you're raising money.
Very true. Yes. We don't ask for any tax information. We do ask for household expenses just from a goal setting standpoint, but we'll walk through each family with that. But we don't need any documentation like that. Whenever we're replacing someone, for instance, if they have to quit work or unable to return to work, we'll help with those household expenses up to the amount of money that the family member would have earned. But we'll walk every patient through that process so you know exactly what the outcome would be. Transportation and lodging is a big number for us, but honestly, those household expenses by far and away are the biggest piece of what we pay. And last year, it was about 60 cents of every dollar that we paid out was for something that happens at home rather than something that happens at a transplant center.
And then for the person who's getting the transplant, if they're over 18, do you pay a salary to them or that totally goes through unemployment or something else?
That's a great question. Our guidelines are that we can help any patient up through the age of 21, regardless of the diagnosis. But for those patients, and CF patients qualify here, that have a single gene disease, CF, PKD, sickle cell are 3 of the main ones that people have that we work with. There are no age restrictions whatsoever. So you can start with us at 25, at 35. Our oldest CF patient was actually 62 when he received his life-saving transplant. So we've had a lot of people that just have been healthy enough that they've not needed to be transplanted. But what we do is we'll walk a family through how we pay household expenses. The IRS doesn't allow us to pay lost wages because then we would have to take taxes out of those payments. And that's not a great benefit for our families. But they do allow us to pay those household expenses. So we'll pay mortgages, car payments, utilities, all those other costs that you would have just in any case living that are a part of your day-to-day expenses.
And I think one of the biggest things that we do as well, and that I'm hearing that COTA does also, is if you know you're going to get a transplant ahead of time, they can apply to us for the grant because once you're in the midst of it, you don't have time. you are just fighting for your life, and your parents and everybody is focused on the immediate challenge. So I'm glad to hear that that's something they can do pre-transplant. The other thing I wanted to ask you was if you need 2 transplants, and of course you don't know that when you're getting your first one, but it sounds like that's the benefit of having the money there for your lifetime, because I know so many people with cystic fibrosis who've had to have 2 transplants. That's a huge benefit because your money's already there. You don't have to fundraise again.
That's right. And I think one of the difficult things that for all of us, not just for any patient, but I think we all are a little reluctant to want to ask for help. And going through a fundraising campaign where our volunteers are asking for help rather than a parent, a patient's spouse, or the patient themselves, we're able to do that in a way that the volunteer makes the request. And so it doesn't feel like you're out there asking for something for your own benefit. And what we look at this as, it's better to have that money set up in what I would refer to as a rainy day fund, so that when you do need it, you have access to it, rather than, as you just described, Laura, that when you're in the midst of transplant and you get the call, you don't want to have to worry about this. This is something that you've already got set up with COTA. We'll just start paying those expenses as they come. And that's one less thing that you have to think about as you're going through that already stressful transplant process.
And I have to say, the little bit that I was involved with Colton, my nephew, he does not have cystic fibrosis. And I don't actually want to say what it is because I don't want to get it wrong, but it's something different. He had a bone marrow transplant. But when I was with him at the NIH, in Bethesda, and everything was so easy for him in dealing with COTA and getting a support person there to give my brother a break, that just made everybody's life so much easier. I thought, wow, this is like a little miracle.
Well, thank you. And I think Colton's case is a perfect example of how we help, going from his home in Michigan to Bethesda, Maryland, to NIH, transportation, those lodging costs while they were living there, while he was being transplanted. There are a lot of expenses that each of us think about. And when you have something like a broken arm or broken leg, you know what your costs are going to be. My wife just had her knee replaced earlier this summer. We knew what our out-of-pocket costs were going to be. But what most people don't think about is transplantation is not a one and done kind of situation. You have expenses every year. Most of our patients meet their out-of-pocket maximum in the first quarter. I have some patients that have told me they meet it by the end of January every year. That's just what you're going to have as a nut to cover for the rest of your life. And so if you think about maybe it's only $2,500, which I know $2,500 is still a lot of money. But if you think about what's that going to be for 10, 15, 20 years down the road, that's $50,000 over 20 years just for your co-payments. And that doesn't include all the other expenses that you have. So one of the great benefits of working with COTA is that money is there. It's available for your lifetime. We often pay for things that most people don't think about as transplant related because we've been doing it for 36 years. And we just know that's a legitimate cost that our families will have. And oftentimes we can anticipate that just because we've been doing it for as long as we have, that until you've been there, you just can't understand what are all those costs that will just be coming at you left and right.
And the other thing I wanted to ask you too is there are all those costs that are coming at people. What are some of the stories that you hear from people that you've helped who didn't know the process? I guess no one knows the process going in. So after they started using it, what did they have to say to you about how it works?
The most common thing that I hear is that I wish I had started with COTA earlier than I did. And going back to your earlier question, I think, Laura, one of the things that parents don't know is what they don't know. And as you go into this process, you have no idea what those expenses will be. When you hear you're going to be at the transplant center for 3 months, you think, okay, that's 90 days. I can do that. But you don't think about the fact that over that 90-day period, you're going to have income that's been disrupted while your expenses are going up. So oftentimes families will tell me, I wish we'd started sooner so that we could have started putting those bills into the system, getting reimbursed. A lot of our families have completely exhausted all of their PTO. They've exhausted their savings account. They're borrowing money from friends and family. Having a COTA account would allow them to not have to do those things, and we would step in and pay for those expenses. The other thing that I hear a lot from families is we don't allow our patients to do the fundraising. So for instance, in your nephew's case, we said, you need to find a volunteer to work with us so that you can focus on getting back to full health. He did that. His volunteer team did a fantastic job. And now with your younger nephew, he's now stepping up and he's serving in that role as the lead volunteer. The thing that I hear most often from parents is, I really didn't like it when you told me I couldn't do this. But now that we're through the process, I really appreciate that you said, don't do this, focus on your child or your loved one, just because you've got so many things that are thrown at you, all the physical, emotional, and psychological things that will happen. You just can't anticipate having fundraising not be added to that heap of the stressors. That's where COTA can help. Let you focus on your loved one.
And, again, I'm not going to mention his name, but somebody with cystic fibrosis, he's put all this on social media. Again, I'm not saying anything out of turn, but he had to get a transplant in another state. He had a mortgage and he had rent, and that's why he came to us. And then you need transportation. It's everything that you've talked about, but he has kids also and a wife. So she's caregiving for him. And of course, she wants to be there with her spouse. There are so many factors that it just grows out so much further. You have to have somebody take care of the kids while the wife or the husband is taking care of their spouse. So there are so many other variables that head into this, aren't there?
There really are, especially for adult patients where you do have a family. I think that's one of the most difficult things is trying to figure out how do you take care of your children, your spouse, how do you take care of all those things that you have every day, regardless of your diagnosis. And then add in the medical stressor and the expense on top of that. Just think about going from home, and I'll use Durham again as an example. We have a lot of patients that have been transplanted to Duke. Even though Duke provides great care, Duke still has expenses that you'll have while you're living in Durham, and you just can't go home and sleep in your own bed at night. So just transportation, not just the cost, but the time it's involved. If you have an 8 a.m. clinic visit, you can't get there that morning. You have to go the night before. So you have that time and expense. And what do you do with your children? How do you make sure that everything at home is taken care of? And what happens when, and this happens all the time, you think you're going for a 1 or 2 day clinic visit and you're there for 2 weeks. Those kind of arrangements, having someone there that can help with that, and that's where COTA steps in to help, really can make that a much less stressful period of time.
And then because you're a nonprofit, none of this impacts your insurance, your private insurance, correct?
That's correct. Yes. And for a lot of our patients that have Medicare or Medicaid, because the money comes to COTA and then we pay the bills, it never shows up as income for those families. And so it doesn't disqualify them or cause them to pay a premium. Again, that money is not taxable. So any benefit that you receive as a COTA patient, it doesn't show up anywhere as a taxable incident. And again, for the patients that are receiving it, the donors actually do get the tax receipt for that, and they can deduct those expenses on their taxes. No one gives for the tax deduction by itself, but a lot of people will give a little bit more knowing they're going to get the benefit out of that.
Does it also pay for a psychiatrist or a psychologist? Does it pay for that too, which is something huge that most people would need?
Absolutely.
I mean, I think we all need it, but
Especially after the pandemic. That's right. We pay for counseling, both for the patient and for their spouse or their parents. We can pay for other things that most people don't think about. Like, for instance, for many of our patients, for dental issues, we can pay for those expenses because going into a transplant, that's an infection issue that could possibly crop up. We want to make sure those things are taken care of. We also provide respite care. So if you have for instance, your spouse is with you, you need a break, we'll have that taken care of so that maybe a grandparent or an aunt or uncle can come in and help out. Much like what you did, Laura, we want to make sure that our caregiver also is taken care of, not just the patient, so that they don't burn out and they get an opportunity to step away and get some mental health time as well.
And then if people are wondering, how does this benefit COTA? Like, are you making money from other people's money, or how does that all work?
Great question. As a nonprofit organization, we don't have a profit sharing plan. We don't give money, no bonuses for patients based on the number of dollars that we raise or the number of patients we help. Obviously, we'll want to help more patients. That's the mission of the organization. But our goal is to make sure that we're raising money to meet those out-of-pocket expenses. And we've been very fortunate that in our 36-year history, we've been able to pay those expenses that come along. And we're very good about balancing our budget and don't make commitments that we can't keep up with. But we want to make sure that we're helping families, and any money that's left over at the end of the year goes back to help ensure that we're able to help more families the next year and help them with unmet expenses.
So the money that people raise stays with the people. And obviously, I'm a nonprofit, you're a nonprofit. So if they're raising money just for families, does COTA raise money just for whatever all your costs are separately from families?
We do. We have 3 main areas in which we're funded. The first is we do some fundraising for our organization. In fact, we have a fundraising event coming up in a couple of weeks, so we'll be doing that. We also write grants, and sometimes the grant money goes directly for patients' benefit. Sometimes it goes to cover our programs that we offer. We also use the interest income while money's being held in an account to pay expenses for our patients. That interest income we retain. And then we do have a building in which we rent a pretty significant share of to a physical therapy practice. And so we have rental income for our space as well. So those three different income streams cover all of our expenses. So that's where we're able to guarantee that 100% of what's given to help our patients actually stays to help them. And we're not using it to pay my salary, keep the lights on, all the travel that we have to get to hospitals, to do visits with transplant professionals. All those things are covered in other ways. But again, 100% what's given for our patients actually stays with them for their lifetime.
And nonprofits are so meticulous about money and everything and transparency. I think we should just flip it all around just so there's a much better sense of respect and everything for nonprofits, because I think sometimes people are just like, oh, it's a nonprofit, and don't see it in the same light as these big corporations when we're doing such important work that helps so many people. So I love what you do because we're all kind of in this together doing the same thing. I've just heard great stories about it. And, one of my nephews is cured and he doesn't have this medical debt. And again, he didn't have cystic fibrosis. There's no cure for cystic fibrosis yet. He has something else, but it's huge that the patients that you help aren't left with an enormous medical debt.
And that's really our hope. We want to ensure that families remain intact. They have a home to come home to after the transplant takes place. And we want to ensure the viability of that transplant. So if someone isn't taking medications because they can't afford it, we don't want our patients to choose between food and the prescription. We don't want them to choose between making a clinic visit or not because they can't afford the gas. Our goal is to make sure that they can be compliant completely with what their medical team says, this is what you need to do, and to keep their family and household intact so that when they do come home, they return to normal and hopefully their health status improves enough that they're able to do that. But our goal is to make sure that whatever the outcome is, that they're able to get back to whatever their routine is. Just on a personal note, Laura, my family was impacted by transplant. I had a cousin who had a bone marrow transplant due to leukemia. And I know what my aunt and uncle went through with my aunt in Los Angeles, with my cousin waiting for his transplant for several months. And then I know my uncle was back home in Kokomo, Indiana, with 3 other cousins and trying to keep the family together, maintaining 2 different households, maintaining all those expenses. It just is a huge nut for people to cover. And we want to make sure that everybody gets back together again once the transplant takes place and have a wonderful outcome.
Absolutely. And, we touched on this briefly when we were talking prior to this, but there are so many variables. Even in my girl's case, they're both not living in Michigan. Only one of them is living in Michigan, but if she moves out of state, the secondary insurance that covers her copay, like things change because insurance changes. In another state, it's not the same. So you have to be very aware of how that changes because each state is obviously different. Do you have any stories that you can share about any of the parents' relief of when this worked for them?
I have lots. One of the benefits of working in an organization that's smaller like ours is that I get to talk to all of our families, and I call families on my cell phone. So everybody has my cell number, and so they can reach out to me at any time. And I'm sure you do the same with the people that you work with at the foundation. But I think, Laura, one of the neat things is I get to know families. So meeting your nephews and your brother was a wonderful experience when I was in Michigan recently, and having the chance to hear what are those things that are going on in the family's lifetime. I look at it that I want every one of our patients to be like that patient that I mentioned earlier, that's 30 years post-transplant. I want them to have the experience of getting married, doing all those things that you want to do, going to college, taking a vacation. I mean, think about how many times can you not go on vacation because you're paying medical bills? That happens to all of our families. And to be able to have someone like COTA come alongside them and make sure that that's not something you have to give up in order to keep your health care intact, that really is life-changing. And to be able to have a normal life for your family, that's what we want to make sure we ensure that.
Absolutely. And the families that we've talked to, too, are just so relieved when they get a bill paid that's been either gone to collection sometimes, is hanging over their head. Same thing. And the transplant stories, you just want to give everyone all the money that you have because the stories are so heartbreaking.
They are.
Even if one parent decides to take family leave, they're giving up their income for 12 weeks to be somewhere. It's just so much. And then there's so much stress on just trying to help your child.
And I think that's where our organizations together can have a great impact on families' lives. We can take that stress away from them, allow them to focus on other things. And as parents, we know there are always going to be stressors when we have children. But if we don't have to have that added stress of financial issues, bill collectors, I've had several patients that have called just in tears. They're having bill collectors knock on their door, being able to call someone and say, here's a credit card number. We'll take care of this expense for you. Oftentimes it's just $100 or a couple $100. But that's that stressor that just is the straw that breaks the camel's back. And we want to make sure that we can remove that from them.
Well, thank you. And is there anything that I didn't ask you about COTA that you think is important to mention to, potential people who want to take advantage of your services?
I think we've covered just about everything. And one of the things, Laura, I do encourage people, go to COTA.org, take a look at what we do. Give us a call. We'll walk you through the process, explain how we work. There are other organizations that do this. If you'd like to take a look at them and do that comparison shopping, I encourage you to do that too. I think we'll come out ahead because what we do is very, very good. And I know that from a fundraising standpoint, we raise more money than the organizations do for every one of our families. And so we think we're a great value for families as well. But the most important thing is we want your patients to be comfortable with what decision is that they're making. And we hope that decision is us, but we also recognize that may not be the case. We really want people to make decisions that help their families the best.
I think it's a wonderful program. So I encourage people to check it out. We'll put it on our resource list on our website, but it will also be here in show notes in this podcast. So people can also click on it there as well. So Rick, thank you so much for joining us and for letting everyone know what the COTA program is all about. And I'm just scrolling down here because I can't remember what COTA stands for, but I don't have it in front of me. Why don't you tell us again what it stands for?
Absolutely. It stands for the Children's Organ Transplant Association. But I always say, I've argued with my board for a number of years that our name doesn't say who we are because we don't just work with children, and want to make sure that people know it's not just organs as well. We do work with bone marrow and cord blood transplant patients as well. But we really appreciate this, Laura, and thank you for everything that you're doing at the foundation and making a difference in the lives of CF patients.
Thank you.
The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Viatris, Genentech, and Vertex. It was produced by Jag and Detroit Podcasts. Follow our show on Apple Podcasts, Spotify, or wherever you're listening right now.